a little bit about myself. I was born in Brazil, so I was born in Rio de Janeiro, Brazil. Spent my first 8 years there, and when I was 8, I moved to the U.S. Me and my 3 brothers and my parents immigrated to Miami, Florida, or South Florida in general. So that's where I spent most of my childhood. So in South Florida,
I'm from Miami too.
oh, nice.
Very cool
Sorry,
sync.
sorry, what did you
I grew up in Coconut Grove.
Coconut Grove. So I grew up all over South Florida, right? So we started in Kendall, and then we moved to Broward, and I went to like middle school and high school in Broward. Yeah, so I grew up all over South Florida. So lived in Little Havana for a bit as an adult. Um, so I moved around a lot. I think what I've been thinking about sort of lately or the past couple of years is like, oh, I wonder if my first introduction to like psychotherapy was through like my parents, right? My parents, they were like ministers, like local community pastors, and they took in a lot of people into our house, right? So I got to meet a lot of different folks with different walks of life, and my parents would kind of sit with them at the table and just like whatever, and I was sort of like in the background, like watching TV or something. I was like, I wonder if that was my first like introduction to like therapy per se, right? That was my first experience around it, right? Sort of at the kitchen table, just hearing these people's stories, even if it was sort of like I was sort of in the background, just like hearing their stories and just like knowing their walks of lives and whatever it might have been. Someone cheated on their husband or blah, 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 or just like, or they just didn't have enough money and they were homeless, whatever the reason was that my parents took them in. There's always sort of this narrative and this story that I was like really intrigued by as a child. And that's something that I've lately, for some others, have been like surfacing for me. It's like, I wonder if that was sort of like this part of me that's like, and now for some reason I'm able to connect dots a lot for folks in my office and be able to kind of say, oh, I wanted this and this, because like these narratives are not as new to me because I've heard them plenty of time. So that's something that's sort of like in the back of my mind I've been thinking about lately a lot. Yeah, so that was sort of my introduction, I guess, to like sitting with people, being around people, and also hearing a lot of difficult stories, right? And then growing up in South Florida, my parents for a bit moved to North Carolina, and then they moved back to Florida. I, for a while, did not know what to do. Like, what should I do with my life? I worked in nonprofit for a bit. I always knew I wanted to be sort of like in the helping profession. I started initially working with folks in North Carolina at a time, with a lot of the Latinx community, especially around like arts and music and some of that stuff. I did that for a bit until one day somebody sat with me. They're like, hey, I have a friend that's in Arizona and they work with the indigenous population. I think you'll do really good with them. I was like, huh? You're like, yeah, you should go. And like, so I had a job interview to work in Arizona in the indigenous community, right? And this was sort of like what they call like a respite homes for children who was having like behavior issue per se. And so I really was like intrigued by it. So I was like, yeah, this is something. So me and my wife at the time, I was like, I really want to do this. I know it's like we're moving across the country to Arizona and to work with Native Americans. And so that's what we sort of did. I did that for about 5 years. 4 to 5 years. It was a huge change in my life, right? I got to sit with a lot of these folks. So it was a behavioral health agency. And I got to meet a lot of people there. So there's a lot of therapists there, right? So my supervisor was a LCSW, and she was like, you should go to graduate school. We're telling you to like do something to like teach kids all this behavior and coping skills, but you're like sitting with them. You're like, and you're like, you should really try to become a therapist and this and that, right? And I was really intrigued, right? Because I got to meet the individuals, and then I got to meet their families as well. So I started working in the respite group home with kids. And then I started working with families, right? Family who lost custody of their kids. So like doing a lot of family unification work. So like bringing them in together and kind of having them have these meetings. And from there, I was really interested in just like the sort of like that family dynamics and also intergenerational stuff that was sort of happening in the room, especially in the Native American community. It was very much obvious to see, just know a little bit of their history of like, okay, this is like really just sort of like passed down. This is where like sort of the trauma kind of happened. And I got really into the concept of trauma, and I started reading about trauma anywhere I can get, right? And then I decided to go to graduate school in New York City. So I went to Columbia University, School of Social Work. I really enjoyed my time there, right? So Columbia was really, it was a lot else kind of happening. My wife at the time also had twins while I was in graduate school. So it was a lot that was happening. But I got to experience a lot of the city and introduced to a lot of different things, right? Earlier, you're mentioning school of thoughts and like theories and different things. I guess when I went to Columbia, they were sort of in this place of like transition, right? So I remember having one of my professors, he's an older man. He's very like a psychoanalyst, right? He's been there forever. And he's like, I remember the good old days. Everyone wants to be an analyst. And this, our school is going down the drain and all of this, because there was a lot of CBT that was moving in, right? We had a DBT program as well. That was part of it. So I got to experience sort of all of this different like theories there, right? But I feel like I was really, really fortunate to have a really good internship. I interned at a huge community mental health center in New York with like over 100 therapists, right? I had an amazing, amazing supervisor that I still kind of like in my mind kind of go back to her. She is this woman from Pakistan. So she's from Pakistan. She's from Pakistan. She's amazing, right? Very like psychodynamic person. She always like, who are you in this room? Who are you in the room? And she's like, and like just help me process things, right? And as a person who was like in graduate school wanting to help people, was like, I want to help, I want to have interventions. And she's just telling me like, you have a lot of anxiety. Like, what anxiety? What are you talking about? You want me just to sit there? And like we used to go back and forth so much. And like I at times kind of go back to like, oh man, she had so much wisdom. She had so much wisdom that I was really, really just blessed and fortunate to like be around and sit with and think about, right? To think about who I was in the room, why I was feeling things in the room, why I was so anxious in the room also, right? And that helped me become really much aware of who I was in the room, who I am in the room to this day, right? I currently live in Los Angeles. I have my own practice. It's called Sunset Trauma Therapy. And I also work in a group practice called Epiphany Counseling, which is in South LA. So I get to see a lot of folks from a range of backgrounds, right? I usually work with a lot of men with history of trauma, and also a lot of folks with history of abandonment, right? So a lot of my focus is around like attachment and some of that work, and folks who have experienced abandonment and some rupture in their childhood. So that's, I guess, all of that's an intro or a long, exhausted conversation about myself per se.
Well, it's a great introduction to you and different places that you've lived and experiences you've had. Yeah, maybe we can touch on different ones. So you started actually doing social work after being at Columbia, but before that you were working, you said, with the indigenous populations, and before that in the center in North Carolina. What was that work like?
In North Carolina or in Arizona?
Both.
Oh, yeah. So, and I will say, so there was the differences. In North Carolina, I was very much sort of in this activist or advocate role, right? So like helping folks kind of get access to different things, that being food or different things. But also we kind of built a studio, like a music studio. So to have kids come in and learn about music, I have a little bit of music background. So just to kind of help them kind of, oh, this is how you kind of record music. This is how you write music and this and this and that. So that's something that was very much hands-on in that sort of way. Arizona, it sort of introduced me to like the behavioral health world, right? Because like I started seeing diagnosis and all those different things, and it was a lot of it was like, wait, what? Like this kid remind me of myself. What's going on here? And like I didn't get into all of this, like into this clinical world as a child, right? So a lot of it, I started really trying to understand like what's happening, right? And a lot of the kids that I started to work with and be with, I had a lot of experiences with them that I think I still kind of sit with me, right? From even like small experiences of like, oh, like me saying like bye to them in the evening, right? And they're like calling me dad and this and crying. I'm like, whoa, what's going on? I'm like, your dad, right? And it's like, in hearing about their just like experiences and trauma and everything, their backgrounds, like, oh, this is like what's happening, right? And all of these things that was, and in a way, I learned a lot about the human experience in Arizona, right? And also like the human suffering a lot, I would say. And at the same time, how folks also like are very much resilient, right? They show up every day. It was very, very, I would say difficult at times, right? Because you're working with kids, a lot of behavior issues or family members, right? When I was doing family unification stuff, those folks who had struggle with like substance use and some of that stuff, right? You're working with them and you're like, it's like, no, don't relapse. So that was like my first experiences around that, right? And I think for me, I really got to experience sort of like that social work and just being in the community per se. I really enjoy my time and in Arizona, right? With that population. And just, I remember just like really being a part of the community per se, right? So I would be able to go into the reservations. I knew people at the corner store. I knew different families that I would drive by. They would say hi to me. I will say it was something that to an extent, I also learned a lot about myself, right? I started to see these experiences that some of these kids were having. I was like, oh, I had that. I guess that is a problem or something that I had that I sort of dismissed my whole life, right? And sometimes like sitting with these families and seeing the pain around some of these conversations, I was like, oh crap, like I also experienced that, right? And I didn't know what countertransference was at the time and none of that stuff, right? And I was like, wait, what? Like that? Did I just like dismiss my whole like childhood or these things that I really just pushed down? And that's something, again, that we're constantly working on. I've been in therapy for many different times and many different years, right? So I say that experience in Arizona really, really drove me to who I am today, I will say, right? It was a lot of joy, but also like a lot of suffering at the same time. Yeah.
Absolutely. And I love how you trace it back to your parents and being pastors and kind of taking people in. That's like, that's like, they're like the original kind of therapists, right? Listening and helping and how you tied your work in with activism and kind of really being on the ground in these ways. And it sounds like that's continuing in your work now.
Yeah, very much, right? I think that social justice lens was something that I was sort of like taught at a very like young age. I was born in Brazil and in Rio, and in a very, right, I lived what they call like in the favela, right? And a lot of it was like very community-based. Everything was community-based, right? You know everyone, and you know who is like, okay, he's so-and-so, he's the pastor. We can go to him about anything, this and this and this, right? And like sort of that idea of community was very much something I like grew up with as a child, right? Like, oh, so-and-so doesn't have money for like food this week. How can we help her? Right. And like literally like being able to knock all your neighbors' doors. And it was something I would really sort of like learn as a kid, right? And and then for now, I really sort of like treasure some of that, I guess, social justice. I think that's one reason why I went to like social work school, right? Compared to the other avenues to become therapists, right? Because I sort of always have this like social justice lens, and kind of seeing the person in the environment and sort of that. So I think that's one of the main reasons why I picked to go to school of social work.
Yeah, I mean, from what I've been hearing, I think the social workers are on the forefront now of kind of the changing of the mental health paradigm. And it sounds like the education in social work schools is like much more on the cutting edge and being progressive than a lot of the other kind of programs.
Yeah, I think so. That I think that's sort of always been a part of like the social work program. Like you're always gonna like what they call it, the person in the environment, right? So we always gonna look at the person in the environment that kind of circulates around us. We look at the family, the community, the macro, right? So everything that's sort of happening that's impacting that individual, right? Why are they coming in a certain way today, right? And I think that was, again, one of the biggest reasons why I chose the program that I went to. Yeah, so I think I still see it from that lens per se, right? I think I still sort of like, okay, this is happening for them. They're stressed about this issue and this and that, right? I don't have a role where I do a lot of like case management or resourcing in that sort of way, right? So I help folks more like process what's going on, so that part of them that's sort of like trying to make sense or even just cope with what's happening around them is something that I tend to work on.
Absolutely. I found when I lived in New York for a time too, for like about 10 years, and I worked at the hospital in Brooklyn. And I found, at a certain point, I was like, therapy isn't going to help people if they don't have stable housing. So I ended up just kind of taking on that kind of case management, social work role a lot of the time, and just making calls and being like, this is Dr. Sinclair, to kind of try to use that to get things pushed through for them, because it's like, they can talk about it all day, but if they're moving house every couple of weeks, they're not going to feel better.
Yeah. And a huge part of my work, and I guess a lot of therapists' work, is to make folks feel safe, right? It's really hard to process things and quote unquote move forward in therapy if they don't feel safe, right? If they're not feeling safe, they're constantly having all these things happening in their lives. I remember one example. I had this class on trauma in graduate school, and this professor always used to say, like, you can't treat trauma if they're in a traumatic environment, right? If you're trying to like process quote unquote trauma with folks that they go home and they're in a domestic violence relationship, that can't happen, right? So a lot of the work is what I do, right? I am trained in like trauma modalities, right? Like EMDR and some of that stuff, right? But a lot of the work that I really try to work with folks is bringing in some type of safety and connection, sort of like that relational part of it, and attachment is something that I usually am my main focus, right? And to kind of help folks, okay, and then to help them kind of process where this stuff kind of comes from and how they're also holding this stuff, right? Why are they holding this stuff in this sort of way, right? And the reasons why they're holding this information, or right, their defenses are coming up from this and stuff. So a lot of my work is around that.
Would you talk a little bit more about EMDR? We haven't had anybody on that talked about EMDR. And I used to work my internship I went to Nova Southeastern University in Fort Lauderdale for grad school. And my internship was at a brain injury clinic. And they had it like mandatory that everybody went to EMDR. I was the only therapist there. And then everybody went to EMDR. And it really seemed to help people. And that's really, I've heard a lot of great things about it.
Yeah, I can definitely go into EMDR. Some EMDR therapists who are really into the theory might not like me as it, because I have more of an integrative approach. I'm not so like, I just do EMDR.
But I love integrative. I think that's the best way.
Yeah, and so actually, I was introduced to EMDR when I was in Arizona working with the Native American community, right? So I worked with families, and and I got to meet a lot of the therapists that work with the individuals and the families, right? So it was sort of being part of that group that we kind of worked together. And a lot of the people in my age, a lot of the therapists were trained in EMDR, right? And I was like, what is this thing that you guys do? Like, well, this sounds kind of fishy. I don't believe it. And I'm always like a skeptical person in general. And a lot of it, right, they were processing trauma and they tried to explain to me. So I read a lot about EMDR. And then that was like sort of my first introduction to it, right? So a lot of my clients, they kind of went through it. Some of them really, really loved it. Some of them were like, I don't know about it. It's kind of weird, right? When I was in graduate school, I was, my supervisor, she very much was like against, sort of like against, was like, what is that? Like, no, you don't do interventions and things are over, right? So she's like, no, like don't. She's like, EMDR is like just like nothing, whatever. But I also went through EMDR as a client, right? And it was very, very helpful. It was very like interesting to per se, even as like a client, and kind of trying to process all of these events and kind of having all of these events kind of come up for you. It was something that I will say it definitely gave me a lot of like insight to different things, and it's very much used in a way that kind of helps with some of the symptoms around like trauma, right? So if folks having had a traumatic event happen to them, right? This EMDR usually really helps actually with the somatic parts of it, right? So if a person's like, let's say if they had a car accident, right? And at an intersection, right? So every time they kind of go back to the intersection, their body's like jumpy or whatever it might be, right? EMDR kind of helps them like, hey, let's focus on this image and do the bilateral stimulation, right? And they can also notice what's happening in your body while you process it, right? So your body might feel jumpy in the office, and your therapist says, okay, this is what's happening for you. Okay, kind of focus on that your body is jumpy, right? And to really have this connection, okay, what's happening in your body and mind. But EMDR is more than that. I was trained very much through like an attachment lens per se, that you have to kind of create safety in the room before you're able to process any kind of trauma, right? So the way I was trained, right, is like they say, like, hey, like if you're getting stuck, there's a reason why you're getting stuck, right? If a person is like getting like whatever, shutting down or getting mad, or there's a reason why that's coming up. You can't just try to override that. Like you have to kind of process that, right? Why are they shutting down where this trauma is happening, right? And to become aware, okay, like there's something that's happening right there. We have to process that, right? And that's the way that I was trained, right? Just not to just go and override everything. But EMDR, it is processing like specifically like traumatic events, right? So a lot of folks that do come to me with like, right, they'll come to me because of I am training EMDR, so they speak a lot of history of trauma, and we're able to process a lot of that. Some folks are able to have just a huge experience around it, where they feel like, oh, like some of the symptoms around it is gone. I just have like nightmares, and that's gone, right? I still sort of have sort of this like psychodynamic way of like of treating folks. So there's sort of always like ongoing work that's always present in the room for me. So even if there is this traumatic event that we might focus on, there's a lot of things around it, right? So to be able to process some of that, it's also sort of the work that I integrate, right? So a lot of it is not so much the trauma per se, but also what happens after those events, right? How does your mom respond to you? How does the community, everyone around you kind of responded to you after this happened, right? Or did anyone respond at all, right? And it's sort of, that's the work that tends to sort of like also like light me up more than the traumatic event per se. It's, okay, this is sort of the things that's sort of happening around that, right? So and that's what really got me to the abandonment stuff, the feelings of abandonment, right? I'm a person who, for some odd reason, enjoys, I can talk about them, right? But enjoys working with folks who have experiences of abandonment, right? And a lot of the times I was like, I never experienced abandonment. I grew up with my parents at home, right? But like I said, my parents were very much busy being like pastors, right? They were serving the whole community, right? They were sitting with folks, right? And I didn't get much of that experience from my parents, right? And it's like, well, I was like one of the four boys, right? And we like middle child of four boys, right? So it's like a lot of the times, like my parents kind of overlooked us, right? Because they were so busy like serving, or like, hey, can you guys help us serve, right? Not very much checking in, attuning, and some of that stuff, right? And I think from that sort of my own background, I have such a sensitive part of me around folks who have experienced abandonment, right? Forms of rejection, and that's why I really, to an extent, try to sit with folks who have that experience, right? And for them to kind of process and have a voice, right? Bring in a voice of the voice that they didn't have as a child per se. So yeah, we'll do the bilateral stimulation when the trauma event is there, right? Like, okay, this happened, right? And not to minimize the traumatic event, those are very huge, right? But I'm a heavy believer in that the things around the trauma per se is as important, right, to focus on. Yeah, so
no, that's absolutely true. And it's like I think about a lot with like psychosis and psychotic breaks, if the community, held the person, or kind of it wasn't so stigmatized to have these things, like, well, a lot of people have these experiences in their teens or early 20s. If there was a better kind of paradigm around it, then you can help people kind of integrate it or make sense of it and work through it, and live, productive lives, however you want to describe it. But instead, it's like so stigmatized. It's like as soon as something happens, then the doctors are like, this is chronic. You're going to have this the rest of your life. That doesn't help anybody feel any better. You're like, oh shit, what's going on? And it just makes more anxiety, makes everything worse,
Yeah, I worked 2 years at a hospital, right, working with a lot of folks with severe mental illness. So I can definitely relate to that. I kind of brought in this sort of different perspective to a hospital. It's very much focused on behaviorism, right? They're like, well, when you do this, do this, and do this, I'm like, I'm not gonna do that, right? I don't even know how I believe those treatment plans. It's a whole different story. Like, you have the wrong one. My supervisor like loved me. It's just like, I love and hate you. Like, you're like you help me think about things a bit more. But at the same time, I need you to write these notes a certain way and do these things a certain way, right? But one thing that I really, with that community, right, folks who have experienced just psychosis and some of that stuff, I got to see, right? I mean, I started hearing a lot of their stories. That's what kind of brought me in. It's like, well, it's a lot that just happened to you, right? A lot of things happened, and here you are now, right? You're sort of in this place that you're experiencing all of this different things. And I think of his name, Harry Stacks
Sullivan.
Harry Stacks Sullivan, right? So he's the person who kind of was like he coined the term, like, a person doesn't have schizophrenia. They're not schizophrenic, they have schizophrenia, right? I remember I wrote a whole thing on Harry Stacks Sullivan when I was in graduate school, right? And I was really amazed by his work and everything that he did, and even in that community, right? So I was like, I gotta see the person. I have to see the person, right? One thing that I from a friend of mine when I started working there, and I was having just like a lot of just like trouble in general with like just a lot of the suffering that I was coming up against, right? And it's like, man, these people are very much like disassociated from a lot of their selves, right? And I was just really just like, that felt really painful for me, right, at the time. And I remember a friend of mine who was a therapist, he was like, you have to get in touch with your own side, that own side of yours that you have. And I was like, no, I don't have this part, like, quote unquote, dark side of me, right? And I think that work for me was a huge part of it, right? Where I was like, okay, like, I have these parts of me also that's that I've also sort of like repressed to an extent, right? That's very much dark. And I had to tap into this part of me to be able to also serve this community, right? To serve these folks. And I very much, after working with them for 2 years, was a lot, but I very much enjoyed it, right? And to be able to help them also like understand a lot of themselves, and also understand, well, right, there's different theories around voices and this and this, and but also like see some connection around it, right? Like, oh, like this very much sounds like your mom, like this, right? And it's like, huh, and like let's think about that, let's process that, right? And one thing you also mentioned earlier, the community, right? I think we do a very like horrible job in the US to have a community go just surround these folks, right? Where are you again? What country
now
are you
I'm in Sweden.
Sweden. I can't think. There's a Norwegian country that does a really. I could be mistaken here. I'll probably read. There's Norwegian country that does a really good job with folks who experience psychosis, right? Where they really have sort of community-based aspect of it, right? Very much of like, how can we support this person, right? That we don't see the person as a threat to the community per se, right? Because a lot of times the treatment that we have in the US, like, oh, they're a threat, right? This person is a threat to the community. How can we keep the community safe, right? It's actually about keeping the community safe and not helping the individual, right? It's like, how we can just keep them away from the community hurt. I know
lock them away.
Yep. And right. And one thing just to even like process, I was like, are you treating the person, or are you treating the community? Who are you actually treating here, right? What's your goal here as your therapist? Are you just trying to keep them away? Are you like some like weird person who's like, I don't want them on the streets, right? Or just whatever it might be. And I know it's complicated, right? People have a lot of experience with folks with mental health issues, but I know in a Norwegian country, I can't think of which country it is, they did a really good job of like helping some of those folks, right? And having just kind of be able to have like extended psychotherapy for them, and be able to help like providing housing and some of just like basic needs. Am I
No, you're right. I'm going to research more about the other Scandinavian countries, but I know for sure in Denmark, they have really good programs for it, because I know of someone who's using that system right now, that basically has kind of psychotic breaks in late teens. And like they took them out of school and put them into like a therapeutic environment, like a community schooling with other people that age, because they know if you like invest a lot, early on, then they have much better chances of, again, like having a productive life and, getting on their feet, rather than, just medicating and kind of locking people away. So they really try to address it like full on as soon as anything comes up like that.
Yeah, no, yeah. And I think, yeah, it could be Denmark. I know I read about, when I started working at that hospital, I read so much of ways to kind of treat those individuals, and then like where across the world, how people treat them across the world, right? And because I really wanted to really be able to kind of sit with them and be with them, right? And I think that was sort of my whole goal, even when it was tough. Yeah.
No, I was also the person in grad school I was like, I'm not going to treat adults like that. Like my supervisors were like giving me little handouts they wanted me to fill out with people, and with like cartoons and thought bubbles and all this stuff. And it's like, this person's got like chronic trauma for like their entire life. They're older than me. They're like veterans, and they've done so much, and I'm not going to give them a little handout with like cartoons on it. Like, I'm just like, that is just not right to me. Like, I'm like, I'll listen to them and I'll see what we can do, but I just wouldn't do it. And my supervisor was like, okay, well, you don't have to do anything. I'll tell you what I would do. She was very behavioral and CBT, I guess. I'll tell you what I would do. And then, you can see if you want to do it or not. And then by the end of my like supervision with her, she's like, you have to try some of the things that I do. And I was like, I'm just not going to treat adults like that. I'm sorry. Like if I was treating kids, maybe I would give these to kids, but I'm not giving these things to adults. I'm sorry. I just wouldn't do it. What else did I want to ask you about that you mentioned? No, I've lost it. Oh, the importance of being integrative. I love this as well, and like being eclectic, and something that like when people come to see me, they often ask like, how do you work? And really like the answer is, I see like what your needs are and desires and what you want out of treatment, and I kind of tailor what I'm doing to the needs of each person, and that can change also during the treatment. So I don't agree like with this very like pure psychoanalytic idea that like psychoanalysis has to be a certain way, like on the couch 4 times a week, the analyst barely talks or whatever. I just feel like, you know, you have to meet people where they're at. That's not realistic for most people. You can still work psychodynamically or psychoanalytically, but like for example, if you have a skill like EMDR and you see someone has a severe trauma, like why can't you integrate that, you know, for a period, and then it's still, like you said, like work, you know, relationally or looking at attachments around that. Or like for me, like I did one of my rotations was doing like relaxation training exercises with the biofeedback machine, so I like really know like relaxation. And it's like if someone's coming in with panic attacks and like they haven't had that kind of training, like why not give them that kind of skill early on to kind of help mitigate their symptoms while they then go into the more intense talk therapy afterwards, you know? I don't see them as like contradictory. It's like we have all these skills and they're all different ways of treating people or helping people. So like, why can't you kind of pull from all these things in your tool bag, you know?
Yeah, I definitely agree with you 100%. I do integrate like some mindfulness here and there in my practice, right? Even so like my EMDR therapist in New York, like one thing that he really taught me, right? So he was right in Midtown, right? So his practice was right in Midtown, like on the 14th floor of like some building, right in Midtown. So like I remember just like I used to come to him, like just like really just like a lot of energy and just really sort of anxious per se, right? So I was very much in the city, right? Got off the subway, sped walk, just kind of walked through the city, went up to his building, right? And he always like, hey, we're gonna sit here for about a minute or two, take some breaths. We're gonna kind of help you transition, right? I know some folks, they want to use that energy. So when they walk in, let's use this energy as soon as you walk in. But I think there is something to like even just kind of helping folks transition, right? You're taking all this time, right, to kind of be here and this, let's help you transition to be here, right? So to even like, hey, let's take a couple of breaths, right? And this is how you take a deep breath. And it's something I will do, right? When I'm very much using EMDR, I really will end sessions and really try to close it in with like a mindfulness exercise per se, or grounding exercise, right? Especially because these folks are processing this very like difficult traumas. So EMDR kind of teaches, okay, let's help them close it, right? Let's help them kind of close it and settle their body. And also, you also are teaching folks, right, to process difficult things and also be able to hold and ground themselves, right? So process and ground. So you're teaching their body that they can do this, right? So like that tolerance, right? What they call like windows of tolerance and trauma therapy, that you're kind of helping them do this, right? Like process very, very difficult things and then be able to ground yourself afterwards, right? And that's what you're kind of doing through sort of like that trauma processing, experiencing, right? That you're doing that, right? Difficult situation, then grounding, difficult and grounding, difficult and grounding, and slowly grounding, right? And I will use that, especially when I'm doing EMDR at the end of each session, right? So I think that's what's very like helpful for, right? Helping them breathe, settle the body, also just even getting to know what's happening in their body, right? I do use some like somatic based stuff at times to kind of help them kind of be aware of what's happening in their body. Like, oh, you feel something in your chest. Let's kind of sit with that for a bit, right? And just kind of help them sit and become aware with everything that's happening, right? I think the concept of like mindfulness, if I had to kind of like put my own definition around it, right? It's sort of this awareness. You're teaching folks how to become really aware of what's happening to them, right? It's not about actually changing or this and this. It's like, oh, you feel something in your chest. Let's sit with that. Okay. Oh, you feel something in your shoulder. Let's notice that for a bit, right? And that constantly going towards the self. You're constantly helping them go towards the self and notice what's happening for them, right? If it's a thought, if something is in their body, whatever it's happening, they're like, okay, let's notice it. We don't have to change it. We don't have to judge it, right? Just kind of just notice it and breathe and just kind of, and sort of that's sort of the work that essentially that you're doing, that you're kind of helping to continue to go to their self. Okay, I can go to myself and process this, right? Now, like myself feels like safe, okay? And you're kind of helping them create this whole new internal dialogue per se with themselves, as though internal sort of experience with themselves, right? So you're like, okay, let's notice what's happening for you in this room, right? Does that make a bit of a sense?
Absolutely. And just increasing that awareness, because people so much in our day-to-day lives are just like, we have like tunnel vision, you know, we're just like focused on like going to work and like getting our needs met and like just functioning in this society, you know, and so much of ourselves is blocked out. I mean, that's how I see psychoanalysis too, is just helping people become more aware of more of their mind, because they like block so many things out. We block so many things out. We're going through our day-to-day, and like all these thoughts and dreams and like memories are popping up, and we just like push them aside, or you like take time every week or a few times a week to start seeing, what are these thoughts, what are these memories, what's going on here. It like so much it takes so much energy to keep all of that stuff out of your consciousness. And if you can start allowing it and becoming more mindful and aware of like your mind and your body, then it just frees up so much of your mental energy, you know.
And I think the goal for me around that, this is probably my own personal goal as a therapist, right? I don't usually tell clients this as much, right? I think it does build that self-compassion, right? Because you're constantly going back to yourself. You're constantly seeing these parts of yourself, right? And over time, that's what builds the self-compassion, right? And again, I work with a lot of folks with history of abandonment, right? So a lot of this work, right, to be able to kind of see themselves, right, a part of the self that they also pushed away and they sort of abandoned as well, right, to be able also to start seeing themselves and naming those things, creating stories around the narrative, but also what they're doing, they're constantly going towards their self, and hopefully the goal around that for me is like that self-compassion happens, right, that they're able to have some compassion for themselves.
That's huge, because people are so hard on themselves, and often when people are being so mean to themselves, it's like, well, what if a friend came to you with this situation, like what would you tell them, you know? And it's like, oh, they'd be so much nicer and more supportive than they're being to themselves, you know.
100%. Yeah.
And then I just have questions. These are kind of for me.
Yeah.
One is what do you think of EMDR? Is it useful with the like chronic traumas? This is like if people have like a history of like having chronic traumas, or is it better like at the brain injury clinic? They used it because if you have a brain injury, there was some sort of accident, you know, something happened that you ended up injuring your brain. I mean, once in a while it'd be like a heart attack or something, and people wouldn't have oxygen, but most of the time it was like a car accident or a on a bike and a car hit them. So I know it's really useful for that, but is it useful for more like chronic PTSD, that sort of thing?
Yeah, I will say so, right? I think a lot of it's so one thing I was taught, I guess, with EMDR, right? Of course, folks are going to process things differently, right? But if to have sort of that safety and attachment in the room really, really helps processing trauma, right? I don't think you actually process any trauma without having the safety and sort of having the therapist very detached in that way. So I think that's a huge part of it, right? So folks who have been able to sort of have a lot of benefits from EMDR. They have some sort of safety, or right, they grew up in a secure attachment home, right? So that's so it was easier for them to process. They process a lot quicker, right? So if there was like a random, I guess, accident they had, so they're able to process. But when there's a lot of other things happening, right? So there's what we call like quote unquote complex trauma, PTSD, right? So it's a lot of things and constant things happen. It's a lot more work, right? It's a lot more things that's there in the room, and I'm a person, I don't think that you just can like do like one session and say like, hey, okay, we're going to find the origin of this, right? The first time that your mom did this, right? And we're going to process that, right? Like that feeling is probably helpful for a bit, right? But I think there is also a lot more work that kind of goes into that. I don't know about like physical stuff. Is that what you mean by chronic? So like something like a brain injury and people getting healed, or?
No, just like ongoing, like multiple traumas, really.
Yeah, so I think so. Again, yeah, so I guess that whole concept around it, right? So if they had multiple ruptures in their childhood, right? So like abandonment issues, like folks who have parents like in and out of their house, right, in and out of their home, and have a lot of abandonment issues. I think it's helpful, right? I think it's a way to be able to process things. Again, I'm a heavy believer in attachment-based work. And I think that ongoing work is huge for folks who had experiences of complex trauma, just in general with abandonment stuff, right? I don't think not one session, but like whatever, there's this 12 to 16 sessions paradigm that some folks use, right? I don't think that actually treats like complex trauma. Some people will fight me over that, right? But I think there's reasons why we sit with folks for a significant amount of time, especially folks who have had a lot of ruptures in their childhood, right? A lot of different things that happen to them. And a lot of it, right, that's where like the attachment part, right? You kind of become sort of their attachment in the room with them. And that sort of thing kind of plays out, and you're helping them like process these difficult things, right? And all of these things will rise through that, right? And the ongoing therapy around that. So I think it's helpful. I think it's really good around it. I think it could be a way to kind of usually settle a lot of folks also, right? So so if they had a lot of like, right, if you want to use like the term anxiety, right, because of a lot of like their childhood experiences, a lot of the trauma, right? So they're just a person who are very just like anxious about a lot of different things, right? So sometimes EMDR can help with that, right? So like they're slowly but little, like their anxiety kind of is able to decrease, right? So maybe like panic attacks, right, are able to go away over time, right? And then I think for me personally, then you're able to do a lot of the work, right? Not that the EMDR is not the work. Does that make a bit of sense?
No, I mean that's exactly true, and that's like psychotropic medication originally was like to help the symptoms, but back then, when that started, most psychiatrists were also analysts, and the idea was more that you would give people medications so that they can manage the symptoms, so that they could then do the work, and then eventually they get off medications, and then at some point the paradigm shifted where it's like, oh, it's just easier to just like give people meds instead of actually doing the talk therapy, So it's a similar thing. You have to help people. You have to help people manage their symptoms. That's why they're coming in, and the symptoms can resolve over time with talk therapy. But it's also nice to have tools to kind of manage them in the short term too.
And as a person who has been in EMDR myself, but also has seen other therapists, right? So I know like the parts of it. I know what EMDR sort of helped me with, right? And to be able also to like, I became a lot aware of like some of the traumas that was there, right? Because even like processing the trauma made me think about other different things that were connected. So I was like, okay, all of these things are sort of like connected to this thing, right? And then I went through psychodynamic therapy, right? So to also be able to have a voice and process and vocally be able to talk about these things I think it's huge, right? EMDR, I think in part, I love it that folks doesn't have to like, it's not very language based, right? So the person's not sitting there verbally processing everything in the event, right? But I think there is something also healing about giving folks a voice that didn't have a voice when they were young, right? It's not so much about telling the traumatic story, but to like have like, okay, this child didn't have a voice. Now what you're doing in this room, now you're bringing that voice, right, that child never had, right? And I really believe that's sort of healing, right? I believe it's healing to an extent, right? And I had that experience, right? Just being able to tell my own narrative, right? My own experience of like, oh, that kid who was just middle child, right, got overlooked a lot, and this and this and this. Now he gets to speak, he gets to tell his story, he gets to talk about it, right? And that's why sometimes I'm like, okay, if we're so focused on like interventions or this or grounding too much, right, you're missing this part of it, right? To be able to say like, oh no, like let's hear the voice, let's hear this part that didn't get to actually, they didn't get to experience as a child, right? Does that make a bit of sense?
Makes perfect sense. I think now I'm asking because I've also done a lot of different therapies, but I haven't done EMDR. So now I'm like, maybe I should try this too and see what it's like, because I hear so much about it lately. Do you think people do it online? Do they do it remotely?
Yeah, so there's definitely different platforms that helps you use EMDR, and Raspberry it was the platform that I use that will have two circles go across the screen, and people will follow it, right? And there's also different ways to do EMDR, right? So there's the bilateral stimulation with the eyes, and then you can also do like the hands as well, what you call the butterflies on each shoulder, or you could do on your legs. Even when I did it in the office in New York, I did it on my own legs, right? So that's the way I experienced it, and right, and it for me, I feel like it worked, right? What an interesting part of it, right, which happens in every therapy, I think. A lot of like images and memories kind of surfaced that I was like, whoa, like I totally forgot about that, right? And so a lot of this like images and memories kind of surfaced for me. And some of it was like random images, like, whoa, I haven't thought about that. I mean, like being a young kid and like hiding from my parents and like looking at like a pornography magazine, right? Like it's like, oh, like I just like that memory was like gone, right? And it's like, oh, like that. And sort of like being aware of some of those little things that you're like, oh, like I was like 10 years old. Like I don't remember that, right? Or like the first time I like got hit by another kid in the classroom, right? In kindergarten, it's like, oh, like I totally forgot about it. Right?
It's really
So like
far back.
yeah, so some of that memory, I was like, oh, and to be able to process. So that's what that little kid felt, right? And I sort of been doing this behavior for a really long time, right? Like this happened, I was shut down, right? Conflict happens and I was shut down, right? And to have that memory of like, oh, I did that when I was 5 years old, right? I was scared of this kid in my class and this and that, right? And I think that was huge for me, right? To be able to process some of that stuff. One thing that happened to me a lot with EMDR, my own experience, was that grief came up for me a lot, right? So we're processing these like trauma per se, and they're like, okay, there's grief around this, right? So a person will show up in my processing, and I'm thinking I'm processing the trauma. It's like, no, you're actually all these emotions will rise, right? Of grief, like, oh, this person's not here anymore. And like that was something that really came up for me, right? And that's something I still sort of like process to an extent, right? It's like, oh, interesting that like we got stuck a lot on my MDR because like grief came up, right? And they're like, oh, like you should go see a different therapist because like you have all this other stuff. And it's like, and I actually think it was very like, I mean, I think it was huge, right? Because I was like in graduate school and like I was having twins, all these things was happening. Yeah, and that like these experiences of grief that I never got to like experience, right? Which I kind of repressed it throughout the years, right? I think one of them was my grandmother, right? That I think I lost right before during graduate school, and she was also huge in my life. She like helped raise me for like the first 12 years, and I was like, oh, have no emotions, right? She passed away, I had no emotions. And I was like just really hard on myself, like, well, I don't have any emotion. This lady like helped raise me. Like I haven't seen her in a while because, right, I'm here in the US and she moved back to Brazil. What some of that trauma therapy did, right, it actually brought up this like, oh, your grandmother's in the house. And as soon as that happened to me, I started to grieve, right? And that was huge for me, right? So like some of the memories and images that also tends to happen in other forms of like psychotherapy, right? But I think EMDR really tends to like surface some of that stuff, right? Because you also think you're coming in from one specific trauma, like, oh, this happened to me, right? Or this and this and this. And what happens is, right, you start going back and like, no, this is actually where the trauma like originated, right? This is from a very young age. This is what happens, right? And so I think it does that pretty quickly for a lot of folks that, right, they come in like, oh, this happened to me. Something happened to me while I was in college and this, right? And you start working with them and then their memories start surfacing like others, like childhood stuff, right? And you're like, oh, this childhood trauma, this is actually what you're here for, right?
Yeah, like that was already a repetition of something earlier it was touching on.
Yeah, very much, right? And to be able to help them process that. And I think EMDR really does a really good job of that. And again, I use it and it's very helpful with a lot of folks. Some folks, it's a lot, right? Because it's sort of this thing of like, okay, hold this image in mind. They're like, this is a lot, right? And so there's for me, I tend to kind of slow down with people who are just not able to just hold that much, right? Because I think it's a lot just to kind of tell people like, hold this image, think about this image, this very terrible thing that happened to you, right? And we're going to do this bilateral stimulation, right? It's not exposure therapy per se, but it has some components around it that's very similar, right? And I think that's the part of me that's always that I'm constantly coming up against. Sometimes like I'm not gonna just kind of put people in the fire. I'm not gonna throw you in the fire, right? You're able, if you're beginning to talk about these things a little bit more, and you're able to hold some of this, and then we can probably process that trauma through EMDR. Yeah. I'm a proponent that folks should be in and out of therapy for their whole life. People might hate me for that, right? But like, yeah, I think trying EMDR, I love that I tried EMDR and my experience around it, right? It did not fix me, like it did not do this whole thing around me. Actually made me aware of a lot more things, right? And it helped a lot with some of the symptoms also, like with like anxiety and some of that stuff. So I think it's really helpful, right? I think it's also really helpful with images as well. If folks are dealing with a lot of intrusive images or thoughts or some of that stuff, it could be really helpful as well, right? And to be able to process some of that stuff. I also went to like more somatic based therapists. Yeah. And to have that also was huge, right? And as a therapist per se, right? You get to kind of pull from some of all of these people that you work with, right? But I would encourage it. I think it's really good, right? And again, different EMDR therapists have different ways of kind of doing EMDR. Some people are very much by the book, right? Some folks have more, I guess, more of a holistic way of viewing it, right? I think Shapiro, when she kind of created it, EMDR, she had a more like open way of viewing it, right? She comes from a very more like psychodynamic background. So she had like this attachment, like attachment was very much part of it, right? Why are these things kind of happening? Why are you getting stuck, right? What's kind of happening that's kind of in the middle? You have to actually process what's happening, right? What we call like ego states, right? These different ego states kind of show up, right? And you kind of processing those things and kind of helping them kind of go into that, right? And I think that's part of the work that's I think it's huge, right? And it's a lot that's happening, right? To be able to sit with folks, I think that'd be able to process. I think that's not so much the intervention, right? It's the relationship. It's being with people, right? I think that's the healing concept that's under most therapy, right? It's not so much the technique, the intervention, but people who are able to really create safety and they're relational.
Absolutely. And is there anything you wanted to be sure to mention that we didn't get to?
No. Yeah, just thank you so much for having me. I really enjoyed it today.
Thank you. I did as well.